Hi, I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Ziva Fertility is conducting a free camp for patients suffering from infertility. We are conducting this camp in the month of May on every Saturday at Kompally, Sanat Nagar, Banjara Hills and Manikonda. Included in this camp are free registration, consultation, counseling and semen analysis. Subsequent treatment options will also be suggested to you and you can avail this opportunity. I am Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. I'd like to talk to you about Follicular Study today and how it can help you in increasing your chance of success at pregnancy. Basically, Follicular Study is performed to monitor the growth of follicles inside your ovaries. Let's try to go back a little and understand how the anatomy is and see what Follicular Study adds to this. So these are your ovaries, your tubes, 2 ovaries on either side, 2 tubes and your uterus. So inside the ovaries are a number of follicles which are pre-decided in every woman when she was in her mother's womb. Every month one follicle is released, one egg is released from either side of the ovary. It comes and waits in the tube, and if sperms are present, fertilization occurs. The fertilized eggs then travel through the tube and implant inside the endometrium. So that's basically what's happening in nature. Depending on the duration of your period, depending upon which side the egg is released, your chance of success depends on whether your tubes are open, your endometrium is good, your husband's sperms are of good quality. All those increase your chance of success. Now, how does Follicular Study work and how is it helping you in increasing your chance of success? Basically, it works for people who are not sure when they are ovulating, who are not sure if their follicles are growing in size and therefore their eggs are growing and they are being released. They are not able to plan their intercourse in such a way which maximizes their chance to conceive. Follicular Study is basically done with or without medication. If it is done with medication, it is called ovulation induction with Follicular Study. If it is without any medication, it is just called Follicular Study. So to understand this, you have to be able to talk about both. In plain Follicular Study, natural cycle Follicular Study, you are asked to come about 4 to 5 days after your period and a scan is done to see whether an egg is getting ready to grow for this cycle and what is the size, how many are growing on either side. That is what is observed. After a couple more days, another scan is done to see if there is growth in that bigger size follicle, which will be our dominant follicle and which is the one which is going to be released to be fertilized. So this is a Follicular Study, and when the size of the follicle is around 18 to 20, it is assumed that it will rupture in a few more hours or days, and that is when it is a good time for you to try naturally. Added to this, if your doctor suggests you do an estrogen or an LH rise or a progesterone test, all these hormones give us indication whether you've ovulated, are about to ovulate, or the hormone levels are enough for the egg which is growing. So estrogen gives us an estimate that it is at the right size and the number of eggs which are growing. LH tells us whether it is about to ovulate, because once the LH rises, then the egg will ovulate. So there are LH kits which are available, which you can do with urine. You can test yourself to see if LH is at a rise. Progesterone tells us that the ovulation has occurred. So these are few tests that you can do to monitor the size of the follicle, the release of the egg, and therefore time your intercourse. The same is done with IUI also, intrauterine insemination, where Follicular Study is done, and at the end of it, when the egg is ruptured, an IUI, intrauterine insemination with your husband's sperm, purified, washed sperms, prepared sperms in the lab, are put back into the endometrium. If you would like to understand a little more, you want help with just Follicular Study in a natural cycle, please feel free to contact us, take an appointment, come down on the day 2 of your period, and we will help you plan your pregnancy better. Thank you. We strive very hard to make these informative videos for you. Please encourage us by subscribing and liking our videos. Thank you.